Okay, so I want to talk about a few disorders of our brain because it's pretty interesting. I find this stuff really interesting. And sometimes I have to cut this out because we start running short on time. But since I'm making these video lectures, I have all the time I want in the world. So let's go over some of these. I'm kidding. I know that you guys are time crunched. So I'm trying to keep this stuff brief. But let's talk about a little bit of brain disorders. So it says the most common brain disorder is a cerebrovascular accident. This is just a fancy word for stroke. So we get a blood clot or a brain hemorrhage causes a stroke. It's one of the leading causes of death after heart attacks and cancer. And there are two types, like I said. There's ischemic strokes where there's a blood supply is blocked. This could be due to a blood clot or something else in the bloodstream, like a piece of fat or an air bubble that causes an ischemic stroke. This is the most common type of stroke. When we think of strokes, most people think of ischemic strokes. So there's a blood clot that gets stuck in the brain and the person has a stroke. The second type of stroke is a hemorrhagic stroke. This is where we have bleeding. So a blood vessel breaks in the brain and we have leaking blood. That leaking blood can cause a lot of damage because it can put pressure on the brain and cause brain damage as it blocks other blood vessels from delivering blood where it should. Hemorrhagic strokes are more serious because they're harder to treat. With ischemic strokes, remember back when we were talking about blood, we can always administer something like TPA, tissue plasminogen activator, to break down blood clots. With a hemorrhagic stroke, we can't do that. You give someone TPA with a hemorrhagic stroke, it'll make it worse because they'll bleed even more. These are very difficult to manage. And so a lot of times with hemorrhagic strokes, it's just sit back and wait and see what happens, which is unfortunate. A lot of times surgery to go in and try and repair little tiny arterioles or something is impossible. So with a hemorrhagic stroke, they're trying to manage the damage. With an ischemic stroke, if you catch that quick enough, you can administer TPA and get blood flowing normally again, and the person may be able to make a full recovery. It is true, when you see these stroke commercials, they say time lost is brain loss. That's because the longer that a person is struggling with a stroke, let's say a ischemic stroke with a blocked blood vessel, the more damage to their brain occurs. So the quicker that someone's treated, the faster and better their recovery can be. If you think someone is having a stroke, don't dick around with that. Just immediately take them to the hospital, get them treated. It's a serious thing, and it is true that the longer you wait, the worse things get. So it says the common cause of cerebrovascular accidents or strokes is the hemorrhage. That's a blood leak. That would be hemorrhagic. An emboli, that's like an air bubble or a fat deposit. And atherosclerosis that kicks off blood clots. And then I just mentioned TPA given to an ischemic stroke victim within 3 hours can really decrease permanent disability. They can get blood flowing back to their brain. All right, another problem are brain tumors. So a brain tumor is an abnormal growth of cancerous cells within the brain itself. Now, it could be malignant where it spreads or benign. The difference between a malignant tumor and a benign tumor is malignant tumors will metastasize. They'll spread somewhere else. Benign tumors are enclosed in the area that they are affecting and they won't spread to other areas of the body. Now it says metastatic cancers, those that spread, are far more common to end up in the brain than actually having a brain tumor. Now this is a little interesting thing about cancer that a lot of people don't realize. is that cancers that spread are still the type of cancer that the tumor originally came from. Okay, so let's just run a scenario. Let's say someone has lung cancer. They have their lung tissue is cancerous, and they are getting lung tissue tumors. Now, if that metastasizes, that lung cancer can move other places. Let's say it moves to the brain. If we go in and we sample that cancer, from that lung cancer in the brain, and we take a sample of the tissue of that tumor in the brain, it's not going to be brain tissue. That tumor is lung tissue that has moved, it's metastasized into the brain. So it says metastatic cancers are far more common than primary tumors. So in other words, someone who may have melanoma or testicular cancer or breast cancer or lung cancer, those cancers will spread to the brain. That's a lot more common than actually getting a brain tumor that is made of neuro tissue or brain tissue. So these metastatic cancers end up in the brain a lot more than we get actual brain cancer. Okay. So it says it's an estimated that there's about 13,000 deaths per year in the United States as a result of brain tumors. So it's not a common type of cancer. All right. Another type of disorder is called a TIA, or a transient ischemic attack. This is an episode, they're often called mini strokes. It's an episode of temporary cerebral dysfunction due to lack of blood flow. So it says there's impaired blood flow to the brain. This is temporary though. So it says the symptoms are basically the same symptoms as a stroke: dizziness, slurred speech, numbness, paralysis, double vision. It occurs almost immediately, but it lasts a short period of time. In a stroke, this continues to get bad. With a TIA, it can last from 5 to 10 minutes, and then it goes away and the person feels fine after this. This is a red flag though. The person that has a TIA needs to get a doctor visit right away, because this could end up, whatever's causing the TIA could end up causing a full-blown stroke. So this is not something to mess with either. So it says treatment for this could be something as simple as taking an aspirin a day as a blood thinner or other anticoagulants. But then they may have to go in and open up those compromised blood vessels by doing a bypass graft or a stent or something like that goes into the brain. So this is a warning. So if someone is having a stroke and then it goes away, don't just say, okay, grandma's fine. No, get her to the doctor. She's having a TIA and she needs further medical treatment. Okay. Alzheimer's disease is one of these brain disorders that we're pretty familiar with. It is a progressive degenerative disease of brain tissue. It manifests itself in dementia. Dementia is the loss of reasoning, ability to think, read, write, eat, talk, walk. In fact, people die of Alzheimer's because they literally forget basic survival skills like how to swallow or how to chew their food. So this is how an Alzheimer's patient ends up passing away. It says it affects about 11% of the population over 65. That is quite a large number of folks. So 11% are millions of people. It says that causes a great loss of neurons in specific regions of our brain, especially the hippocampus, remember memory formation, and the cerebral cortex. So these loss of neurons will cause memory loss and dementia. It also says that there's a loss of neurons that release acetylcholine, so we start losing neurotransmitters. These areas affected by the degenerative process are replaced by plaques, and so they get a lot of plaque buildup. These are basically kind of like scars on the brain. They also get tangled protein filaments that just intertwine through the brain as well. So Alzheimer's is a pretty serious problem. There's been some question on links of what is causing Alzheimer's. They have a link that they think heavy metals, exposure to heavy metals may increase your risk of Alzheimer's. So like heavy metals like lead, mercury, aluminum. A lot of people don't want to cook with aluminum anymore because there could be a link to Alzheimer's. The products in like Teflon products, like non-stick frying pans and that kind of stuff, if that stuff flakes off and you end up eating it for years and years and years, it can cause Alzheimer's. Now, the opposite of Alzheimer's is a disease called amyotrophic lateral sclerosis, or ALS. ALS is commonly known as Lou Gehrig's disease. Lou Gehrig was a baseball player. Here he is right here. He played for the New York Yankees, and he was the first prominent celebrity type figure to get ALS. So they often call this Lou Gehrig's disease. It occurs in about 10%, or I'm sorry, in 10% of ALS patients. We know it's a genetic defect. This is also what Stephen Hawking had. Stephen Hawking had the genetic form of ALS. So we always think of Stephen Hawking, you know, he's in the wheelchair, he's zooming around, he's the great physics guy, philosopher of, things like string theory and all that jazz. I always think of the Big Bang Theory, you know, with like Howard and Leonard and stuff talking about Stephen Hawking. But anyway, he had this genetic version, and we don't really know the cause of this genetic version. So it manifests itself. I think Stephen Hawking was in his 30s when he started showing symptoms, something like that. Some of you may know because they did have a movie about him, and you may know when he started getting it, but I'm just thinking off the top of my head, he was around 30. For the other 90% of cases, they didn't know what was causing it. So it says in ALS, motor neurons of the brain and spinal cord degenerate and scar. So what this does is it leads to first muscle weakening, then twitching, inability to move our arms and legs, and then in fact it affects our whole body. So it says when muscles of the chest stop working, they have to be on a ventilator or a respirator to keep them alive. So basically your brain is fully functional, but your connections between your brain and your body break down. So it is the opposite kind of Alzheimer's. In Alzheimer's, your brain degenerates and you forget everything that's going on as your brain degenerates. With ALS, the connections between your brain and your body degenerate. Your brain is left fine. That's why Stephen Hawking could still do all his theoretical physics, because his brain is just fine, but the connections between his brain and his body are breaking down. Now, for 90%, it says there are no known risk factors except having a family member who has a hereditary form. This has all changed within the last 5 or so years, thanks to studies with ALS patients and the NFL. Turns out that the population of NFL players have a higher incidence of ALS. So researchers started studying this, and they have linked ALS to concussions. And this is one of the reasons why the NFL has done all of these protocols to try and get rid of head injuries. There's that other disease that was in that movie with Will Smith. I can't think of the name of that disease off the top of my head. It's sort of related to this, but ALS, what they discovered is in ALS patients, concussions release toxic proteins in the brain. And these toxic proteins degenerate that tissue connecting the brain and the spinal cord. And it manifests itself as ALS. They studied many brains of NFL patients that had ALS and made this determination. So when you're looking at a lot of the recent protocols we have for things like concussions, this is one of the reasons why. Now, let's go back to Lou Gehrig for a minute. You might think that Lou Gehrig, okay, he was a baseball player. And baseball is not a contact sport as much as football. So you might wonder, well, how did Lou Gehrig end up with ALS? Was it a case of genetics? Well, there's some anecdotal evidence. Researchers went back into newspaper articles and things like that with Lou Gehrig. And I don't know if you know anything about Lou Gehrig, but I don't know if he still holds, but at one time he held like the most consecutive baseball games played by a player. So he never went out of a game. And researchers read through newspaper articles about Lou Gehrig, and they found 11 incidences where the newspaper talked about how Lou Gehrig was hitting the head with a ball or hitting the head by sliding into a base or something like that. And some of those incidences, he actually had to be revived with smelling salts. And then he continued to play the game afterward. So there's good evidence, it's anecdotal evidence, but there's good evidence that Lou Gehrig ended up with several concussions that may have led to ALS. So pretty crazy stuff. So that's ALS. I just find this stuff kind of interesting. That's why I took so long on it. As far as aging goes, I love this slide. It says, from years 1 to 2, we have a rapid growth of brain tissue. So you have all this neurogrowth, you have myelination going on, all these branches forming. Your brain is going crazy, growing and developing. And then it says from early adulthood until death, everything starts falling apart. It says we lose brain weight, decreases by about 7% by age 80. We lose synaptic contacts. We lose information processing. Our conduction velocity decreases. Our motor movements can slow down. Our reflexes slow down. So as we get older, our nervous system becomes more and more and more inefficient. Let's put it that way. All right. So that takes care of our disorders. And I'm going to end the chapter with one more video on kind of a segue between this chapter and chapter 17. So with the disorders, just make sure that you can kind of tell me some basic information about what the disorder is, what are some of the symptoms, and of course, why it occurs.